So good morning, everyone, and thank you for joining us. Welcome to our health and safety webinar focused on heat stress and sun safety in the tourism sector. And I think we picked a good week to do this webinar given the forecast for our heat wave later this week. My name is Lynn McDonough-Hughes with TIANS and the Tourism Human Resource Council, and I'm pleased to introduce this session this morning. We respectfully acknowledge that we live and work on the unceded territory of the Mi'kmaq, which is covered by the treaties of peace and friendship. We are all treaty people. The warm, sunny weather will soon be upon us, as I mentioned this week. And while this provides a great opportunity for tourism and recreation activities, the exposure to extreme heat and UV from the sun can cause serious health problems, especially for outdoor workers. This morning, we will learn how to reduce the associated risks for heat-related illnesses, as well as practical tips for protecting workers. Leading the discussion are Colleen Rodgerson and Beth Campbell, who are both with the Engineering and Sciences team of the Occupational Health and Safety Division of the Department of Labor, Skills, and Immigration. So welcome, and I will pass it over to Colleen and Beth.
Great, thanks, Lynn. It's a pleasure to be here this morning. As you mentioned, my name is Beth Campbell. I'm an occupational hygienist with the Department of Labor, Skills, and Immigration. So thank you for having me here this morning. As an occupational hygienist, one of the things that I focus on is prevention of workplace illnesses. So heat stress falls into that. So I'm going to share my screen here. And there we go. Just put this on large in presentation mode. Oh, there we go. All right. Can you see my screen there? Is someone able to confirm? Thanks, Colleen. Okay, perfect. So I'm just going to move that to the side. Great. Okay. I'm going to be talking about heat stress this morning, and then Colleen's going to be talking about sun safety. So the two kind of go hand in hand. I'm going to run through a little bit of information about heat stress and some of the things that you might want to look out for in your workplace, then talk a little bit about some of the control measures to make sure that everybody's staying healthy and feeling well in your workplace. So these are symptoms of mild heat stress. So these are some of the things that employees should know to look for, and supervisors as well. Heat fatigue. So this is what happens when you start to become a little bit dehydrated. You're losing salt from sweating a lot. You're going to feel tired, maybe a little bit dizzy, thirsty, sometimes even queasy or a bit of headache. And the thing to do in that case would be to move to a cool area and rest. Another symptom of mild heat stress is heat rash. So this would be small red bumps. It can be itchy, and this can also become infected from scratching if that happens. So in most cases, the rash will just disappear when you move to a cool environment. Again, fairly mild. Heat collapse happens when you have low oxygen levels in your brain, and it can cause you to lose consciousness. It comes on quickly, and it's not easy to predict. And the thing to do is move to a cool area, loosen your clothes, drink water, and rest. Heat cramps would be another mild heat stress symptom. So these are painful. It's what happens when you're sweating a lot. You start to lose salt and moisture, and then what you need to do is rest for a few hours, drink clear juice or a sports beverage, or just water with food. So the idea is to get a little bit of salt, but not taking salt tablets, as they're not recommended. So into some of the more severe problems that can come up when you have exposure to extreme temperatures. So heat exhaustion is how your body responds when it's extremely hot and you're sweating a whole lot. You're losing a lot of water and fluids, and this is going to result in your heart beating faster, sweating more. Again, some of those symptoms of mild heat stress, but more severe than that. So nausea, vomiting, irritability, fast, shallow breathing. and your body temperature at this point is going up. So again, the outcomes of the first aid treatments would be a little bit similar. Rest in a cool shaded area, encourage the person to drink water, juice, or sports drink. You want to cool the body, so take a cold or cool shower, bath or sponge bath if you can. Basically try to cool down as quickly as you can. And then this is the most severe outcome for heat exposure would be heat stroke. So this is a medical emergency, requires immediate medical attention. So if you start to see things like body temperature greater than 40 degrees Celsius, confusion, hot, dry skin, or profuse sweating, it could be either loss of coordination, loss of consciousness, seizures. This can even cause coma or death. So this is really severe. And in this case, you're calling 911, cooling the body aggressively, and trying to help the person to rest and just stay comfortable until they can get that medical attention that they need. All right, so some of the factors that influence heat stress, they vary from person to person and depending on what you're doing. So it doesn't affect everybody in quite the same way. It depends on the environment. So yes, the air temperature, humidity, how much radiant heat you're being exposed to, how sunny it is, or sometimes reflection off things like pavement or sand, even on a beach, or whether you work near a kiln or an oven, which is often the case for people who work inside kitchens. You know, inside those big pizza ovens, for example, they're very hot and cause a lot of increased heat load for people to contend with. The work that you're doing, so the more active you are, the more heat you produce, and the more likely it is that you would run into to some of those problems with heat stress, like I was mentioning, and some of the personal factors. So the type of clothing or PPE that you're wearing affects how warm you are, of course. Hydration, your age, your overall health, your physical fitness level, if you have any medical conditions, or any medications that you might need to take or that kind of thing, then those also affect how you respond to heat stress. So people who are older, who are in poor physical health or have different illnesses, of course, are more vulnerable than others. So those are important things for people to know and keep in mind in their workplace. So a quick note about the legal requirements in Nova Scotia. We do have exposure limits for heat stress. Our workplace health and safety regulations are what tell us what those are. The employer has a duty to inform supervisors and employees about the hazards in the workplace. So for the people in your workplace, as an employer, if you're a supervisor, then it's important to make sure that your employees know it could be very hot. These are symptoms to watch out for. It's a great idea to have your employees check on each other and keep an eye out for signs of heat stress, because sometimes people can become focused on their work or distracted or whatever, and they don't recognize it in themselves, but you might actually see it in a coworker before they become aware of it. And there's also a duty for owners to maintain the workplace in a manner that ensures their health and safety. So that might be providing a cool place to rest or providing shade or that kind of thing. So our workplace limits, I'm not going to go into detail about this, I promise. We do have a limit that relies on a special kind of thermometer that looks like this here in the picture. It's called a wet bulb globe thermometer, or we call it a widget for short. So what this does is it takes into account how humid it is outside and radiant heat. So this would be, you can purchase these commercially. However, we recognize that most people do not have a widget in their workplace. So one of the things that we often look at is the Humidex, because it's so easily available. It's easy to find online. I think that it's a good way to get an idea of whether you're in compliance with the legal limit. The Humidex is convenient because it's reported on TV, it's reported on your weather, your weather websites and that kind of thing. So every day you could go online and see what the humidex is going to be for the day and then get an idea of what types of control measures would be appropriate. So the kind of, I don't know if it's a downside or the possibility is that the humidex would actually be overprotective compared to the legal exposure limit. So that's why it's, from my perspective, I'd like to see people being a little bit cautious with this topic. So it's fine for you to use the humidex. I would say that in particular for offices and that sort of thing, like if you're fairly sedentary, this really would be quite protective. So you could kind of choose what's most suitable for your workplace. So this is from the Occupational Health Clinics for Ontario Workers, or OCAL. And they've come up with a guide that tells you if the humidex, will start at the bottom of here of the slide, if the humidex is between 25 and 29 degrees, then you'd want to supply your workers with water. They might need to take breaks as needed. It's not, it should be fairly comfortable for most people, a little bit warm. So if your employees are wearing really heavy PPE, or they have to have like warm clothing on, if they're doing extremely active work, like, that requires a lot of physical labor, then, you can always evaluate that a little bit, but generally you wouldn't need to do too much in that range. As it gets warmer, so 30 to 33 degrees based on the humidex, you might want to post a heat stress alert, encourage workers to drink more water. You can record the hourly temperatures and relative humidity so that they're aware. You get up into the 34, 37 degree range, and you're going to make sure that employees are trained to recognize the symptoms. So if you know that this week it's going to be really warm here in Nova Scotia later this week, so we'll be thinking about these kinds of things, reminding employees about the symptoms and first aid measures for heat stress, and what to watch out for while they're working. When you get up into the moderate range, then you're looking at providing scheduled break times. And this is completely consistent with our legal requirements here in Nova Scotia as well, where the warmer it gets and the more humid and the more radiant heat you'd be exposed to, the more breaks you would need to provide. So in a 1 hour work cycle, you would need to provide a 15-minute break for your employees, providing them with cool water, encouraging them to drink lots of water, and making sure that they have an opportunity to rest for at least 15 minutes during that work time. Once you get up into 40 to 41 degrees, then you're looking at a 30-minute relief cycle in that 1 hour period. So it's a lot of downtime and would require some considerations for scheduling and that sort of thing on the part of the employer. Once you're into 42 to 44 degrees humidex, this is extreme, right? You're into 45 minutes of break time per hour, and then in the most extreme, 45 plus, only medically supervised work should continue, and you're really looking at minimizing the amount of work. So, just again, a note of caution there. So when you're applying the humidex to a non-office environment, this is a simplified version of what we would, require legally. So if there are any questions about how this might apply to a certain type of workplace, then you're welcome to give us a call at the Occupational Health and Safety Division, and we'd be happy to answer questions and try to help you to work through some of those technical parts. We know it's not straightforward, but we're happy to help. And you can also call anonymously, I should say. So if it's something that you didn't want us, we're to have too much information, we can share information without concerns about confidentiality or anonymity. So yeah, we talked about heat stress being overestimated. So the approach that we would take to controlling the risk for almost any workplace hazard is called the hierarchy of controls. So this is it's a model that we know is effective, it's reliable, it's adopted in many different jurisdictions. Maybe you've heard of it before. But generally, what we want to do when we're trying to control a workplace hazard like heat stress is start at the top of the control measures with elimination if possible. So this means removing the hazard. In a lot of cases, we can't control the outdoor temperature, but maybe it means turning on the air conditioning when possible in an indoor environment. Or, sorry, that would actually be an engineering control. But in any case, we want to remove the heat source if possible. So, and then if that doesn't work, then we're going to move down the controls to substitution. So that means replacing the hazard with something less hazardous. For engineering controls, it's isolating the person from the hazard, generally using some kind of like barrier or like an engineered thing. Often ventilation or air conditioning would apply, I suppose, most directly to heat stress. And then we would look at things like administrative controls, which is changing the way people work. So that's things like providing information and, about heat stress and control measures. And it could even be scheduling workers differently. So the work rest regimes that we talked about earlier would be an example of an administrative control. And then the kind of our sort of last resort in most cases would be personal protective equipment. So, and the reason for that, I mean, PPE can be very effective, but the trouble is that we rely on how people use it and whether they use it consistently to ensure that it's actually going to be effective. So some of the risk control measures that are engineering controls might be providing shade from direct sunlight, cooling the environment using air conditioning, like I mentioned, avoiding reflective surfaces if possible. And just one note about using fans. Once the thermometer reads 35 degrees, generally you wouldn't want to use a fan at that point. It starts to have kind of a convection oven type effect where it's actually going to make people a little bit more uncomfortable. Some administrative and PPE controls. So scheduling your outdoor work to avoid those peak UV index times. So those would be your summer days from 11 a.m. to 3 p.m. to avoid the extra heat and sun. Educating managers, supervisors, and employees about health effects and control measures is really important. Providing breaks and a cool rest area if possible. Encouraging employees to rest and stay hydrated, which is really important. I know there's a culture in some workplaces of, go, 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 and you want to get your work done, and which is obviously really important, but also in that culture, especially workers who might be younger or more inclined to go along with that rather than protecting themselves. You just want to make sure that safety culture is really instilled in your workers and that the value for heat stress protection is communicated. Oh, and minimizing the physical demands of each job, so possibly even rotating people if they're jobs that are more physically demanding. All right, so this kind of brings us to the end of the heat stress portion of the presentation here. There are a number of resources. NovaSafe is the website that's used by the Occupational Health and Safety Division. This is a new site that has lots of great information. We're adding to it all the time. So lots of great resources there that are specific to Nova Scotia workplaces. The Canadian Centre for Occupational Health and Safety has lots of great information about heat stress. If you want more information about the Humidex, the occupational health clinics for Ontario workers, there are also a number of other great resources there. WorkSafe BC, Sun Safety at Work. That's a Canadian, Canada-specific website as well. And then we have a couple there that are also just nice resources with links. So if we share the presentation after, then you're welcome to take a look. And that brings me to the end. Thank you. All right. So I'll pass this over to Colleen if Colleen would like to jump in and chat about sun safety.
Great. Make sure I have my sound on. Can you hear me? Okay, great. So I'm Colleen. My preferred pronouns are she and her, and I'm going to talk about solar ultraviolet radiation, also known as sun safety. So May is actually Sun Awareness Month, which is sponsored by the Canadian Dermatology Association. And so that was last month, but it's just meant to kind of kick off the season when the sun's going to be particularly hot in Canada. And so their goal is to encourage Canadians to not only educate themselves on effective sun protection behaviors, but also to embrace lifestyle changes that contribute to long-term skin health. And this past year, they focused on children and adolescents. So for people who do outdoor work, they have two layers of sun exposure. One is from their workplace and the other is from personal activities. And before we start focusing on the health effects that are negative from the sun, I want to capture that there are some positive aspects from exposure to the sun, which include the production of vitamin D in our bodies, the support for a healthy circadian rhythm. But all that said, we do need to kind of find a balance because we need to make sure that we protect our skin, as the Canadian dermatologists have indicated in the previous slide. So the negative effects from overexposure to the sun include skin damage and eye damage. Some of the workers in the tourism industry that might be at risk are restaurant patio staff, outdoor water park attendants, tour bus drivers, whale watching guides, grounds workers at campgrounds, and even bed and breakfasts and motels and hotels, tour guides. That could include people that do walking tours of graveyards, or they do walking tours of downtown. But there's also outdoor adventure workers. Those would be maybe the folks that go rock climbing or bicycling or kayaking and lead tours doing those types of activities. So I'm sure there's lots of others. Those are just a few that I kind of pulled up to make an example. And as the sign says, don't be this guy. This guy actually is a truck driver, and you can see one side of his face has aged much faster than the other side, and that's due to UVA exposure through the window of the cab of his truck while he was driving for many, many years. And so the glass in a vehicle will block out the UVB, so he would never get a sunburn from driving his truck. But as you can see, it still had a photoaging effect on his skin. And so that's why I mentioned tour bus drivers, because they have big windows those motor coaches that they are being blasted by the sun as they're driving their tours along their tours. So if we want to assess the risk, skin damage can be either permanent or temporary. And so temporary includes suntans and sunburns, and permanent includes photoaging and skin cancer. And so the temporary damage, our bodies can repair that all by themselves. They don't need intervention. But for the permanent damage, if you want to correct that damage, you will need medical intervention. The eyes are also at risk from overexposure to the sun. Again, the damage can be temporary or permanent. And temporary damage can be a tissue burn on the cornea. And it's basically like a sunburn, but it's on the cornea of your eye. And I've seen it in a coworker who went to an air show, who basically the bottom part of his eye was red. And I'm not talking like bloodshot. It was literally the entire surface was red. And then the top part was white. And that was from a sunburn that he experienced on the cornea of his eye. The permanent damage can be cataracts, which is very, very common for a lot of our population. As they age, they will eventually develop cataracts, macular degeneration, and cancer. The good news about cataracts is there is cataract surgery, so that can be corrected. Macular degeneration, not so much. And cancer, hopefully, they are able to catch it early and treat it appropriately. So when we look at outdoor workers, they are 3.5 times more likely to develop skin cancer than people that do not work outdoors. And it's estimated that 1.6 billion people work outdoors. This is globally. In Canada, it's 1.7 million people are estimated to work outdoors. And that's roughly 28% or 30% of the population would be classified as outdoor workers. And so we have to remember that the sun and overexposure can also damage your eyes. And again, just to revisit that, for people that work outdoors, they have the added risk because of their workplace exposures in addition to their personal exposure. So if you're somebody who likes to hike and garden, then you're going to have a much higher exposure than somebody who likes to read a good book when they're not working. So I want to dig a little bit deeper into skin cancer. So there's basically two classifications. There's non-melanoma skin cancer and there's melanoma skin cancer. And here I've put that there's some subsets of non-melanoma, which are basal cell and squamous cell. Those are the most common types. There's some subsets of melanoma as well, but I didn't bother to go too far into the weeds, as most people will probably, if they have skin cancer, it will probably be non-melanoma. And just a note that melanoma is the deadliest form of skin cancer. So, but the odds are that most people will have non-melanoma, although there certainly are people that do get melanoma. And skin cancer is largely preventable with, precautions and controls put in place, which we'll talk about. So most skin cancer is caused from ultraviolet light. It's the most commonly diagnosed cancer in Canada. And it's estimated that 80,000 new cases of non-melanoma skin cancer are diagnosed each year compared to 5,000 of melanoma. So again, there's more cases of non-melanoma skin cancer diagnosed than melanoma, but melanoma is certainly the one that we have to be super cautious about because it is the one that is most lethal. And 1 in 3 cancers diagnosed is a skin cancer. And just a note that they don't even track really the data for non-melanoma skin cancers because they're so prevalent. So the 80,000, that's an estimate, but melanoma they track very diligently. So zeroing in on Nova Scotia, we have the unique risk of the fact that Nova Scotia has the second highest melanoma rates in Canada. And I haven't heard a really good explanation for why this is. I don't know that anybody's been able to figure out this particular quandary, but at any rate, that means our risk in Nova Scotia is higher still for unknown reasons. So something to keep in mind. And globally, 1 in 5 skin cancers is a cutaneous melanoma. So that's one of those subsets of melanoma. This is the data for the different provinces across Canada. And you can see Nova Scotia and PEI have the dubious distinction of being the highest. PEI is number 1 and Nova Scotia is number 2. And it's not because we have a lot of outdoor workers, because certainly New Brunswick and Newfoundland have those as well. And just to remind me to mention that, yes, people with pale skin and light colored eyes are at higher risk. So someone like me, for sure, is at high risk. I burn very quickly. I don't need the reminder. But people with darker skin, they are still, have to be cautious and protect their skin because they can still get skin cancer. And this is renowned musician, singer, songwriter Bob Marley, who died at the age of 36 from melanoma. So that was a very young age to die from skin cancer. So how can we protect ourselves? Well, for outdoor workers, if it's possible to schedule your work early in the morning or late in the day and avoid those peak sun hours, that would be helpful. I recognize that's not always possible, but certainly that's kind of one step that could be taken. And also, if possible, provide shade. So if somebody has to cut the grass and it's in those peak hours, it's certainly going to be better if they're cutting it and they have a canopy over their lawnmower like this picture here illustrates. So if you can't schedule your work in the early morning hours or late day, if you can't provide shade, the next thing is to wear long sleeve shirts that are light colored, pants, and a wide brim hat made from breathable fabric. And because you're going to be covering a lot of your skin, perhaps it will contribute to a little bit of your heat stress risk. So make sure you drink lots of water, take adequate breaks. The last thing that can be done to protect our skin is to cover it with sunscreen. And it's recommended that the sun protection factor be at least 30. And that's the minimum. You can go higher, but definitely don't recommend going lower. And you have to reapply it frequently. One of the reasons that sunscreen, like other forms of personal protective equipment, isn't rate it very highly is because it requires a lot of action in terms of reapplication and remembering to reapply it at a timely manner. It should also have a broad spectrum and be water resistant because outdoor workers are probably going to be sweating, and we want to make sure that that sunscreen's lasting as much as possible before it's being reapplied. I also recommend that you check out the Canadian Dermatology website, as they have approved sunscreens that they have a list on their website you can view, so that you make sure that you're getting sunscreens that have been vetted by this organization. And remember to cover your lips. They can burn as well. They're part of your skin that's also exposed. You can get lip balm with sunscreen SPF 15 and sometimes 30. 15 is pretty easy to find, 30 is not as easy, but anything with a sun protection factor in it would be helpful for sure to protect your lips. And I like this picture. It's a public dispenser for sunscreen. And I'll just note that there was a competition in Canada for municipalities to apply to have something similar to this installed in their region. And the town of New Glasgow has won that competition. One of the winners. There's other locations across Canada, but New Glasgow in Nova Scotia will have 2 dispensers being installed this summer, which I'm really excited to see what they look like and what the public does with them if they take advantage of this opportunity. So Beth has already talked about some of the legal requirements. They're kind of the same. They're general broad requirements for employers to take every precaution that is reasonable to protect the health and safety of its employees. Employers must inform supervisors and employees of hazards. So in this case, being exposed to ultraviolet light, which is known to damage skin and eyes, that's a known hazard that employers have to recognize and inform their supervisors. They also have to implement a system to identify and control those risks and hazards. And there is the limits in the workplace health and safety regulations that comes out of an American document called the threshold limit values, but it's really super hard to apply because of the variation in skin tones and the variation in susceptibilities of the workers that are out there in the workplace working, and the different effects that UV exposure would have on my skin versus somebody with a darker skin color, for example. But there's also a requirement for personal protective equipment. When it is provided by the employer, it has to be in accordance, the employee is responsible for using it in accordance with instructions and training that's provided with it. So if people are going to use sunscreen, I really recommend that they read the instructions on the package. It will tell you how often to apply it, and that you shouldn't store it, for example, in hot places, because that can affect the chemical stability of the product. So all those kinds of precautions, you should really be familiar with those. And again, I have a bunch of resources. I didn't check with Beth first, so we have some that are the same, but some of the ones that I have are different are CAREX, which has a lot of great statistics on workplace cancers and carcinogens in the workplace. And certainly ultraviolet light is one of the ones that they certainly have a lot of information on, because it's one of the highest risk factors of carcinogens in the workplace, because it's one that more people are exposed to than, for example, chemicals. The province, through the Occupational Health and Safety Division, put out a bulletin which kind of captures some of the regulatory requirements around sun safety. That's the Sun Safety Bulletin there with a link. Health Canada has some resources there more for public health, but as we talked about, people that work outside, they have 2 factors to consider. They have their occupational exposure and their personal exposure. So Health Canada has some great resources that can be used in conjunction with Sun Safe at Work, for example. But also the Canadian Dermatology Association, like we talked about, they have a list of approved sunscreens, but they also have resource materials in Sun Awareness Month, which is May. So posters and other promotional materials that can be tweeted or downloaded or whatever, if people want to participate in that promotion. And there's also an organization called SaveYourSkin.org, and it's a Canadian organization, and that's the one that allocated those funds for those public sunscreen dispensers in New Glasgow. This is an example of a poster from the Sun Safe at Work website, just to show you that like they have all these materials. You can just download them, print them. They're ready to go. They don't care if they don't have copyright. They're not worried about protecting that. They want to make it easy for employers to embed sun safety as part of their their protection of their employees. This is a mnemonic that's quite helpful, you know, like if you're going to do some training. So slip, slop, slap, seek, slide. Slip on your protective clothing to cover your skin, slop on sunscreen on those areas that you can't protect with the clothing that you've just donned. Slap on a wide brimmed hat, seek shade whenever you can, and slide on your sunglasses. And that's it. So thank you.
Thanks very much, Colleen and Beth. This is great information, a lot of terrific resources for our sector to utilize. I'm not sure if there are any questions for either one of you. Just see if any come up. I think it was incredibly thorough, so I can't think of any. Okay, well, I will make sure that this is available on Tyen's YouTube, because I think it will be a really great resource, especially this week. So I thank you both very much for taking the time to do this webinar. And if you would like to share your PowerPoint presentations, that would be great. I can make sure that they go out to attendees. And like I said, we will make sure to have this uploaded as a great resource for our sector. And I appreciate you taking the time today.
Thanks, Lynn. Everybody work safe.
Great. Thanks so much. Enjoy the
Thank
rest of
you.
your day and stay cool this week.
You as well.
Okay. Thank you.
Bye.
Bye.